Tomato flu in Kenya. Health Ministry speaks. The Ministry of Health has allayed fears of tomato flu, tomato fever outbreak in Kenya. Believed to be a viral disease, tomato flu was the first reported in Kollam district of Kerala, India on May 6, 2022. Since then, there have been about 10 cases of the tomato flu in India, all of them among children under the age of 9. The Lancet Respiratory Medicine journal reports that tomato flu gained its name on the basis of the eruption of red and painful blisters throughout the body that gradually enlarge to the size of tomato. These blisters resemble those seen with monkeypox virus in young individuals. Rashes also appear on the skin with tomato flu that lead to skin irritation. As with other viral infection, further symptoms include fatigue, nausea, vomiting, diarrhea, fever, dehydration, swelling of joints, body aches, and common influenza-like symptoms, which are similar to those manifested in dengue, Lancet said. Although the tomato flu virus shows symptoms similar to those of COVID-19, both are associated with fever, fatigue, and body aches initially, and some patients with COVID-19 also report rashes on their skin. The virus is not related to SARS-CoV-2. Tomato flu could be an after effect of chikungunya or dengue fever in children rather than viral infection. The virus could also be a new variant of viral hand, foot, and mouth disease, a common infectious disease targeting mostly children under the age of 1 to 5 years. Among comprised adults, the virus was also reported in the United Kingdom from samples of 2 children who had traveled to India for holiday. Their test showed they were infected with an enterovirus named Exoski A16 that caused hand, foot, and mouth disease. Closer Home Acting Director General of Health, Dr. Patrick Amont, said the country has not yet reported any case of tomato flu. He said there is no cause of alarm, but because of travels, they can't rule anything out. Should we record any, we will advise accordingly. It may be far, but we can't still record. In case of any symptoms, we encourage people to report, Dr. Amoth said. The Lancet Journal noted that tomato flu is considered non-life-threatening but very contagiously. It is mostly spread through close contact.